So this one's a really strong opinion of mine, and I'll keep it short because I really want to look at some questions. But I absolutely agree. The site's perception, they do strongly influence DCT adoption and acceptance. Number one is it's very, very fundamental. The independent contractor clauses that we have in a CTA don't just mean that sites don't get benefits from sponsors. There are a lot of things that are built around that according to the IRS and according to law. And part of that is that the services sites perform are 100% the site's discretion. So I think one of the things that we're looking at, and I like to use this analogy, if you were running a restaurant and every customer walked into your doors and said, you must cook my food with this spatula, and you must use it, my food and only my food, you have to use this spatula. And then let's say that you have 100 customers walk in and you have a kitchen filled with 100 spatulas. It's going to be really easy to get that mixed up. So you're going to have a reluctance for site acceptance of DCT until you empower the sites to make that discretionary choice on their own. We're doing this on a study by study, sponsor picks the DCT technology kind of a system. It's never going to work on a scaled system because you have to make that assumption. Similar to Phil, the AstraZeneca portal is great. I've used it. I do appreciate it, but my site does far more than AstraZeneca studies. We cannot live solely on AstraZeneca. We have to use the others. All of the e-thingies of the world get onto the shoulders of the sites as independent contractors, and it's just very tricky. I think that you're going to get to a point where we have a universal understanding, similar to Apple or Galaxy. There's some kind of a Play Store where we all make something the same way that can interchange and talk to itself, almost like an Amazon marketplace of technology. Then sponsors will have a generalized universal understanding of what can be done in a trial, what can be built in a protocol, and we're going to be able to do this seamlessly. But we have to put it on the site's shoulders and their discretion, especially as independent contractors.